Hello, my name is Aisling and I'm the Orthopaedic Clinical Nurse Specialist and I work here at the Blackrock Health Hermitage Clinic. Here is everything you'll need to know before you come in for your surgery. The first thing you can do is quit smoking if you're a smoker. Smoking greatly impacts on your recovery as well as wound healing and makes you more susceptible to infection. If you drink alcohol, please limit alcohol over the coming weeks prior to your surgery to as normal a limit as possible. Also, prehabilitation is key for your recovery, and what I mean by prehabilitation is being as active as possible, walking, possibly going to the gym, water aerobics, just staying active in general. As the time gets nearer to your surgery, the best thing for you to do is stay as well as possible. The length of stay for your surgery is in the range of 1 to 2 nights. This will be discussed with you prior to admission by your consultant. Please pack for 3 nights, but expect to go home after 1 to 2. Your night clothes as well as some loose fitting day clothes. You can also bring in your medication, ensuring that it's in its original box so that the nurses and doctors can review this. Small electronic devices are allowed. Please remember to bring in your earphones. Also, don't forget your mobile phone and charger. Slip-on runners or shoes are advisable. Please remember that laces can be difficult to tie after your surgery. Also, slippers may not be as supportive as runners or shoes. If you feel that you need convalescence after your surgery, please be aware that this needs to be organised by yourself and your family prior to coming into hospital. One of the biggest things you can do is make sure that your house is clutter-free. Remove any rugs and mats which may cause you to fall on your return home. Also, ensure that everything in your kitchen is within reach. It's not advisable to overstretch or crouch down after your surgery. Prior to your surgery, you will attend the pre-assessment clinic. This is to ensure that you are medically fit for your surgery. This will include your height, weight, blood pressure, some blood tests and an X-ray, as well as an ECG of your heart. Pre-assessment is a great opportunity for you as a patient to ask lots of questions about your surgery. You will also be provided with a booklet about your hip or knee replacement, which has lots of very useful information. I always advise patients to write down their questions prior to coming in. Here at the Hermitage Clinic, we understand that you may be nervous and anxious about your surgery. We're here for you every step of the way.